All right, greetings guys. This is Alan Bolda, Josh Burke, Kaiser Oakland, Kaiser Richmond Emergency Department, part of our orientation series today. I also have Kevin and Annie once again, and they're going to demonstrate the application of an upper extremity splint. I think today we're going to do an ulnar gutter.
Yeah.
This is just one type of splint. There's various other ones, thumb spike up, volar splints, but today is just an upper extremity splint. Kevin is going to demonstrate that on Annie and the equipment that we use and anything else. All right, so I'll leave it up to Kevin right here and Annie, and thank you. Take it away.
All right. So one of the things I like to do in preparation is I like to cut my tape in advance, so I don't have to worry about doing that while the splint's hardening. Also, we will use this cotton wrap to go around any like bony areas, whether it be on the leg for an ankle or around that bone here on the wrist. Do a little bit of that now. It doesn't need to be a lot, and then you also want to be mindful of trying not to have any wrinkles in it when you wrap, because those may end up being a little uncomfortable later when you have a hard splint on over that. Splinting material and you size, and on a true patient, you'd want to size on the opposite side so that you're not causing any undue pain. So we're going to go about fingers bend here, come down about there. Only need to go maybe 3/4.
So the splint that we're putting on today is an ulnar gutter, and it's usually used for fractures of the 4th or 5th metacarpal, also known as your boxer's fracture. That's your 4th and 5th. It goes right over there. It also depends on how thick you want it, because if it was the 4th metacarpal, then you'd probably want something bigger than a 3-inch. This is a
3-inch, yeah.
Yeah, is this a 3-inch? Yep, 3-inch. So you might want something a little longer, maybe a 4 or 5-incher, so it'll get that far. But usually boxer's fracture, 4th or 5th metacarpal. All right. So what Kevin's doing right now is same thing we did earlier. We're going to go ahead and get it wet, open it up, put it on the inside.
So these will start to harden just by the air. Water's going to make them start to cure a little bit faster. I like to put the water on the inside. Some people will roll them up and dip them in water. Some will just put water on the outside. This way, by going inside, you're not getting the padding on the outside wet and then wrapping that moisture against the patient's skin. This way it's a little bit more dry. I like to kind of pre-tape where I want my folds to be before I get started wrapping. One less thing for me to hold.
Also, just a second, what Kevin's saying, if you don't use any water at all, the process for it to cure and harden will take about 45 minutes to fully harden up. When you put water, it takes anywhere between 5 and 10 minutes, and it's at that point it's still malleable before it completely hardens. So you want to make sure during that time frame, while you're putting this on, that that patient comfort is optimized using some of the techniques that Kevin demonstrated, like the just getting rid of all the wrinkles or any of the folds, and also putting that one piece of padding right there at the bony prominence. That does wonders for the patient.
And sometimes it will be beneficial to have somebody help you hold a specialist splint like this on the patient. When I like to wrap, I just
That's a nice
for
technique there.
presentation, basically.
And same thing as before, a nurse, doctor would also assess for color, motor, sensory, cap refill prior to splint application. And at the end, Kevin's also going to demonstrate what they're checking for afterwards. Make sure numbness, tingling, um, checking for that, and making sure we have proper
Straighten that again.
circulation after splint application. All right, once again, it's a good looking splint.
Alright, so you can wiggle your fingers, and then we're gonna check cap refill, make sure that's still good. And you also wanna, this is the part that may cause you the most discomfort is, depending on where it is, you wanna mold the splint to the arm, to the bones, so that you get the position that you want. And this one you might wanna, depending on sometimes the MDs want they call it like position of function, position of comfort, so it's kind of like bent forward a little bit. When I'm doing a splint, I always ask the MD though if there are any specific instructions they want.
All right, looks beautiful. And lastly, just with any splint, whether it's an upper or lower extremity, just make sure after the splint application, check with the doctor, make sure the angle's all right. Doctor will give the final seal of approval saying, yep, that's a good looking splint, and get the discharge order. So just please make sure you check with the doctor prior to discharge. All right, anything else you want to mention, Kevin? Andy? Looks good. Thanks again. And once again, this is Alan Bolden, Josh Burke, Kaiser Oakland, Kaiser Richmond. If you have any questions, please see either one of us. Thank you.